I was pointing out to Fred. Joining me from Berlin with more is Thomas Sparrow, a correspondent with our partners DW. Thomas, how is the coronavirus situation generally in that part of Europe, and how concerned are authorities about the new variants?
Essentially, there's a divided picture here in Germany. That's how the German Chancellor described the situation here. On the one hand, there is a positive trend when it comes, for example, to the number of cases decreasing, the 7-day incidence also going down. But on the other hand, the number of deaths is still shockingly high, around 1,000 new deaths every day. And there is indeed growing concern over new COVID-19 variants or mutations. One hospital here in Berlin, for example, was forced to halt admissions after several cases of the more infectious variant that was originally found in the UK. Emergency cases were taken to the hospitals and staff were put under a so-called shuttle quarantine, which essentially means that they are only allowed to travel between their homes and the hospital. All this comes, by the way, as Germany marks 1 year since the first person in Germany tested positive for the coronavirus.
So what measures are being taken to deal with these new variants? Here in Ghana, we're dealing with our own, but tell us what's happening on your side.
Well, one clear decision, influenced at least in part by these new variants, was to extend Germany's current lockdown until mid-February and as well to reinforce mask-wearing instructions. So people here now have to wear medical masks in public transport, in shops and in offices. So in other words, they can no longer use their normal cloth masks. A second decision was to focus more on gene sequencing. That means essentially that health labs will have to sequence part of their samples and check for new variants. And then there has been a big discussion about what to do with air travel, what to do with cross-border movements, with reports saying that the German government has been considering drastically reducing air travel and closing borders to regions where new mutations are prevalent.
And this comes at a time when vaccine distribution has become particularly difficult. What are the problems?
Essentially, the distribution of coronavirus vaccines was supposed to be seen as a big reason for hope, and it still is to a large extent, but at the same time it's becoming a very big headache for European officials. The vaccine, and this is important to actually stress, was acquired by the EU for the 27 member states. In other words, not by each state individually. But there have been organizational problems, and the EU is well behind other parts of the world in its rate of inoculating people against the virus. And there have been issues with some of the producers. Pfizer, for instance, had to cut its production, and AstraZeneca announced it would be delivering fewer doses than agreed with the EU. This prompted officials to demand transparency. And EU Commission President von der Leyen, for instance, said that Europe had invested billions to develop the world's first COVID vaccines and said that the companies had to honor their obligations. All in all, a big debate, and one that will probably continue for some time here in Europe.
Well, there you have it, the scramble over vaccine there, even in that part of Europe. Hopefully, we'll have a better situation here. Thomas Sparrow is political correspondent with our partners DW, joining us all the way from Berlin. But here in Ghana, here is a statement that I referred to earlier in one of my interviews earlier. It is coming from the Ghana Health Service. At least that's the signature we get to it. It says that free COVID-19 testing for all walk-in requests such as ill health, contact tracing and exposure. The Ministry of Health has decided that public COVID-19 testing laboratories providing walk-in services can charge only travelers for testing. All other walk-in requests such as ill health, contact tracing and exposure must be done free of charge using